Hello everyone, I'm Pratibha, Assistant Professor of Sociology from Government First Grade College, Siddharth Layout, Mysore. Today's presentation is on the topic infant mortality and maternal mortality. Session outcome will be students will be able to understand the causes of infant mortality and maternal mortality. These are the contents of the slides. Now let's see the meaning of infant mortality. Infant mortality means infants dying before reaching 1 year of age. Infant mortality rate means the number of deaths per 1,000 live births of children under 1 year of age. Infant mortality is calculated by using the following formula. IMR is equal to DO by B into K. IMR means infant mortality rate. DO refers to the number of children who die before completing 1 year of age, which is registered during a calendar year. B refers to the number of births registered during the same year, and K is 1,000. These are the causes of infant mortality in India. Biological factors, early marriage, inadequate medical facilities, poverty, lack of nutritious food, extreme weather conditions, ignorance of mothers or caretakers, outbreak of epidemic diseases. Biological factors like age of mother, birth order, age difference between children, frequent pregnancies, aborting the fetus without the guidance of the doctor, problems during pregnancy, weight of the child, birth defects, etc. causes infant mortality. In rural areas, many of the girls are married at a very earlier age. This also have an adverse effect on the health of the girl who's married, and if she gives birth to a child at that early age, that may result in low birth weight babies, or the girl may face complications at the time of delivery. Frequent pregnancies also affect the health of the women and may also result in infant mortality. Early marriage. In rural areas, illiterate parents get their daughters married at an earlier age. Girls may not be psychologically prepared for marriage. Marriage at a young age may result in unexpected pregnancies, abortion, and birth of low birth weight children. Frequent deliveries and less gap between pregnancies may also result in infant mortality. No adequate medical facilities. Even to this day, in many of the rural areas in India, there are no medical facilities. There are no adequate medical facilities due to the complications that may arise at the time of delivery or post-delivery may result in infant mortality. Poverty. One of the major reasons for IMR in India is poverty. Due to this, many of the poor pregnant women are not able to afford nutritious food and medicines, which affect the health conditions of the child. Lack of nutritious food. The growth and development of the child depends on the nutrition the child is provided with. Mother's health conditions also play a significant role on the health of the infant. Because of poverty, they are not able to focus on their health conditions, and they may not be able to provide better care and facilities for their children, which may result in infant mortality. Extreme weather conditions is also one of the contributing factors for infant mortality. Extreme conditions, for the extreme weather conditions, children may not be able to adjust, which may cause infant mortality. Ignorance Absence of mothers or caretakers, lack of awareness, illiteracy, and more concentration towards their household work may cause infant mortality. Usually in rural areas, women work on fields or they work as laborers, wherein they may leave their infants neglected, or they may not be able to provide the desired care for the infants, which may result in their death. Outbreak of epidemic diseases. As infants do not possess resistance power, they get easily prone to epidemic diseases. Poor environmental conditions also adds up to this. To reduce infant mortality rate to below 30 per thousand live births and to achieve universal immunization of children against all vaccine preventable diseases were the goals of National Population Policy 2000. Various efforts have been made by the government to reduce IMR rate and to bring down IMR to below 30 per thousand live births was one of the goals of National Population Policy 2000. IMR in India in the year 2020 was 29.848 deaths per thousand live births, a decline of 3.48% from 2019. In the year 2019, IMR in India was 30.924 deaths per thousand live births. The current infant mortality rate in India, that's in 2021, is 28.771 deaths per thousand live births. Efforts have been made by the government to reduce infant mortality, and hence there has been a considerable reduction in IMR in India. Now let's see the meaning of maternal mortality. Maternal mortality is defined by World Health Organization as the death of a woman while pregnant or within 42 days of termination of pregnancy, irrespective of the duration and site of the pregnancy, from any cause related to or aggravated by the pregnancy or its management, but not from accidental or incidental causes. Maternal mortality rate, its MMR, is the annual number of female deaths per 1 lakh live births. Causes of maternal mortality are frequent deliveries, ignorance of women towards health, excessive and strenuous work, poor nutrition, inadequate health facilities, poverty. Women mostly concentrate more towards household work, neglecting their health conditions. They may not have nutritious food, and due to excessive work, they may also not have food on time or focus towards having nutritious diet, which have adverse effect on their health conditions, which may in the long run lead to more complications, which results in their losing their lives. The major complications that account for nearly 75% of all maternal deaths are severe bleeding, that's mostly bleeding after childbirth, infections after childbirth, high blood pressure during pregnancy, complications from delivery, unsafe abortion. Other complications may exist before pregnancy but are worsened during pregnancy, especially if not managed as part of women's care. The Government of India has been focusing on initiatives to improve maternal health indicators. Much progress has been made in ending preventable maternal deaths in the past 2 decades. To reduce maternal mortality rate to below 100 per 1 lakh was one of the goals of the National Population Policy 2000. Globally, the number of women and girls who die each year due to issues related to pregnancy and childbirth has dropped considerably from 4,51,000 in 2002 to 95,000 2017, a 38% decrease. Most maternal deaths are preventable. All women need access to antenatal care in pregnancy, skilled care during childbirth, and care and support after childbirth. Usually in rural areas, pregnant women and women during post delivery are taken care of, no doubt, but due to poverty, they may not be given adequate care and uh, facilities which are required by them. So, awareness have to be created for them to take care of their health and focus more towards consumption of nutritious diet. All births are required to be assisted by skilled health professionals as timely management and treatment can save the life of both the mother and the child. As per the report of Sample Registration System of 2016 to 18, MMR of India per 1 lakh live births has declined to 113 in 2016 to 2018 from 122 in 2015 to 2017. In India, several programs have been implemented to reduce maternal mortality rate and to ensure safe motherhood. These are the references made, websites referred. Now let's see multiple choice questions. What does infant mortality mean? The answer is the number of deaths per 1,000 live births of children under 1 year of age. What is maternal mortality rate? The annual number of female deaths per 1 lakh live births. In the formula to calculate infant mortality rate, K represents 1000. IMR in India in the year 2020 was 29.848 deaths per 1,000 live births. Is it true or false? True. The abbreviation of SRS is Sample Registration System. Thank you.